and gentlemen, welcome to another episode of Monitor Your Health, the program where we educate the public on contemporary health topics. My name remains Dr. Femi Ogunremi, and I'll be your host for today. I have with me today Professor Michael Odimayo, who will be, educating us on hepatitis B. We know that hepatitis is a common disease worldwide. Hepatitis B is very important, as we know. As we will be knowing today, that it's a very important disease that we need to understand how people contract it and how we can actually prevent ourselves from being a victim of this virus. You're very much welcome, Professor Odimayo.
Thank you very much, viewers at home. Good morning. I hope you have a fulfilling time.
Thank you so much. Please, can you introduce yourself to the audience?
Yes, I'm Professor Michael Odimayo. I'm a professor of microbial pathology, a virologist by training, and I've been involved in the diagnosis, in the treatment and prevention of hepatitis B and other viral hepatitis for the past 10 to 15 years. And we have had to screen, to vaccinate thousands of people in the course of my activities and manage a lot of cases. I'm primarily a professor of microbial pathology, and I work with University of Medical Sciences, Ondo City, Nigeria, and a consultant to the University of Medical Sciences Teaching Hospital. I'm currently a member of the task force on global hepatitis, viral hepatitis elimination group at the global level. And we have been doing a lot of work towards the control and the management of hepatitis, both in Nigeria and in collaboration with other partners across the globe.
Thank you so much. So now there's no other person that can tell us about this virus than you. Please, can you enlighten us? What is hepatitis B, if we're to start from there?
Well, hepatitis B is a disease that is caused by a virus called hepatitis B virus. Well, to go a bit scientific, we say hepatitis B is a member of the hepatnaviridae family. Don't mind that big name. It's a group of viruses that are DNA viruses that are infecting the liver and are causing disease in the liver. Now, hepatitis B has resulted in about an annual 887,000 deaths, and we have about 247 million people that are at risk of premature death as a result of liver failure and cancers resulting from hepatitis B. In Nigeria, the current prevalence, as at the last national prevalence that was done, we have about 12.3% of the disease in the country. So in 2016, the World Health Organization took a step to be able to eliminate hepatitis B, viral hepatitis across the globe. And the definition of the eradication is defined as 90% reduction in the incidence of viral hepatitis and 65% reduction in mortality by 2030. So you can see that the issue about viral hepatitis in terms of complications such as liver cancers, chronic liver diseases is significant. And it is really worth the declaration that the WHO placed on it in 2016. And there has been global effort at elimination of viral hepatitis across the globe.
Wow, thank you so much. So, I mean, for this to catch such a significant global recognition and for us to have these targets, it must mean that it is a very, very important disease that we need to actually know about. So, as individual, because we have the public, who will be wondering, okay, they're talking about this hepatitis B. In fact, this is the second time we're bringing this topic on this program. There was the World Hepatitis Day or something like that happened last year. So we brought somebody to just talk about it as well. Now, why? I know we talked about its impact on the liver and as a disease. Before we go into the symptoms and how it presents and things, why is it important for us to get people to actually understand this virus and this disease?
Well, this is why it's very important. Is number one, it is very common. In Nigeria, just as I said earlier on, we have about over 12% national prevalence, and it's even higher in some high-risk groups. So for the fact that it is common, and it is also associated with heavy complications, premature death, resulting from chronic liver diseases like liver cirrhosis and liver cancers and some other things. So, and the beautiful thing about it is that hepatitis B can be treated, and also there are vaccines that can be used to control the disease. In 2004, the Nigerian government decided to incorporate hepatitis B vaccination into the national program on immunization for children below 5. And since then, it has been on, though the coverage is another thing that we have to look at, but it's been on. So the disease, talking about the disease is very important because it is common, it is treatable, it is associated with high level of mortality and morbidity. That is, people can easily fall sick, it can result in premature death, yet it is preventable. So people need to know so that they can get themselves, approach the management, the treatment facilities that is available, and then we can save our society from premature death and other complications.
Thank you so much, Prof. So viewers, it sounds like this is something that we need to take, serious attention to. But so what are the things that, maybe predisposed or that make people exposed to this disease? What are the things that people should be doing practically to prevent themselves from getting this infection?
Yes. Well, the doubt is going to look at the mode of transmission of the disease. And the mode of transmission, we have issues like blood transfusion, especially if an individual is transfused with a blood that is not properly screened. Or maybe you have somebody that has sexual contact with an infected individual.
Right.
Or in a situation whereby you have a needle or tissue cutting material like blades, like needles, like other sharp objects that are infected or that are contaminated with the virus. If it's used on another person, such a person can easily get the disease. For a mother that is infected, such a mother can transmit the disease to an unborn child, either in the course of pregnancy or in the course of labor or around delivery period or in the course of the younger age. Because we have seen that in a family, usually you have a mother being infected, a father being infected, even the children can be infected. But beyond that too, we have seen that there are some cases that you really cannot specifically link to some of all these things. So it's been found that some environmental factors like getting some abrasions or wounds from the environment can be a factor. And the reason why it is a factor is this: hepatitis B virus is more resistant to environmental stress. It's about 100 times more stable in the environment than HIV. So if somebody that is infected with the virus maybe have some of the virus on the environment, days after, another person who has a wound or an abrasion to make the virus to enter into the skin, the virus can still infect that person. So there are some cases that where you cannot really link it with any of these factors, but they are basically environmental. And that is where vaccination really becomes an important thing there.
Mm-hmm. Thank you so much. So it looks like a disease that's, if we're not aware, it's so easy to actually, catch this disease. Now, you've talked about, blood transfusion, sexual intercourse, abrasion, contact with all this contaminated blood that can just be trivial, and then one become infected. So, in line with this, are there things, I look at blood transfusion, for instance. If somebody is sick and they're going to the hospital, what can they do? They just ask people. I know in some rural places where, practitioners will ask people to just go and mobilize their relative because they need blood urgently. How much of these bloods are being screened for this? Is there something that you are doing or that we need to be doing to prevent? Because what I think we should be doing is practical measures that will actually make people, be safe from this particular illness. So are there things that we can look in that direction? We talk about sexual, intercourse. Of course, maybe protection, but I'll leave that to you. Are there things practically that people need to be doing, looking at the way by which this disease can be, transmitted practically?
Yes, thank you very much. There are practical things. For example, if an individual needs to be transfused with blood, that is not supposed to be a big problem, provided the person will be doing that in a standard medical setting. Because in such a medical setting, screening will have been done. Even no matter how urgent you want to transfuse that person, whoever is going to donate blood, the blood will have been screened for hepatitis B, hepatitis C, HIV, and so many others other viruses who have screened them. So in a standard hospital setting, so what I would advise is that don't go to take to require blood or need to be transfused if the hospital is not standard enough to be able to do proper screening for that blood before it is being given. And that one tells about even the use of needles and some of those things, which has become a thing of the past. But you have to be sure that the medical setup you have to approach for care have that full understanding. Then with respect to sexual contact and some of all those things, the truth is that we still follow the normal ABC of prevention. You either abstain or you'll be faithful to your partner. And if you are talking about being faithful to a partner, that means if you are planning to go into a relationship that may involve sex with another person, then it's better that both of you go for screening so that you'll be screened for hepatitis B. Not only for hepatitis B, hepatitis C, even HIV, you'll be screened so that both of you can be sure that you are free from the virus. Otherwise, transmission can happen there. But where you think that you cannot be able to abstain, you are not able to be screened and be faithful to a partner, then in that case, we advise people to use condom. These are practical steps to still be taken that can prevent transmission through sexual contact. Then the other thing is possibly for an individual, especially if you think you are vulnerable, to be vaccinated for hepatitis B. There are vaccines for hepatitis B available all over the place that you can get in standard settings that you will be vaccinated. And even I want to advise that when you think you have been vaccinated and you have completed your vaccines, you can still go further to assess yourself if you are really immunized. And that is, there are some testing you want to do. You want to see if the immunoglobulins are there that can protect you adequately enough to be sure that the vaccines you have taken is effective for you to be. And the other thing is, if somebody is infected, well, it's not the end of the whole thing. The person should approach standard treatment services, standard settings where you can be properly assessed, then adequately or correctly treated. And though the treatment needs a prolonged therapy, but that just saves the person from the various complications that can arise from the disease.
Thank you so much, Prof. Now, I want us to now look at, okay, we've talked about prevention, we've talked about, what people need to actually, do to practically protect themselves. Can we now look at what people see when they get this, disease? What are the symptoms or signs that people get when they contract this illness?
Yes. Well, most of the time, when people contact the illness, they may not have any complaint, any symptoms at all. They may not be for a very long time until the disease is becoming problematic, when the complications are coming. For example, I've had to see cases of liver cancers when it will have, as at that stage, the situation is already beyond remedy. So, and some of all those people, as at the time they have it at the earliest time, they may not even have any symptoms. But as at the time they feel that they have complaints, they are coming to the hospital, they have already developed liver cancer, at which stage there is nothing that can really be done effectively to take care of that person. But in the general terms, if it is the acute form, because hepatitis B can come up as acute hepatitis, and it can also be as chronic hepatitis. Once the person has the hepatitis for more than 6 months, we say it is already chronic hepatitis. For somebody that has it as acute hepatitis, really the person may have some things like yellowness of the eyes, like passage of some black or white stools sometimes, and you may have some discomfort in the upper abdomen, especially on the right side, and some weakness and tiredness. But generally, we don't commonly see it in the acute phase. We see it more in the chronic phases, where most of the time the person may just manifest with things like tiredness or weakness. In some cases, you may have people coming out with pains on the upper part of the abdomen, especially on the right side of the abdomen, on the upper right part of the abdomen, that you see people coming up with some discomfort or some pains may come up, or weakness, and some of all those mild symptoms. But as at the time it becomes a very serious complication, it becomes serious manifestation of maybe yellowness of the eyes in the chronic phase, most of the time it is either when they are now at the stage of chronic liver disease, liver cirrhosis, like liver cirrhosis, or liver cancer, when such a person may not be able to be managed again. So generally speaking, what people will see with people is, for the chronic case or the general cases, we see weaknesses, we see some discomfort or heaviness on the right upper side of the abdomen, we see tiredness, and maybe swelling. Sometimes people may see swelling of the upper part of the abdomen. But generally, at the stages where it can be effectively managed, there are usually no complaints associated with the disease. So the person needs to go for screening and possibly vaccination or treatment, as the case may be.
Wow, thank you so much. So again, screening is the hallmark here. The bottom line is screen, get to know early, and then you will be safe from the complication of the disease, which can be deadly in some cases, as the prof is enlightening us here. Right, so now if somebody is they've gotten the symptoms, and we've encouraged them to go for, well, before the symptoms, go for screening. If you have screening, we're saying there is the vaccination, national vaccination program that is ongoing. How do people tap into this vaccination? Well, where can they get vaccinated? What is the process that is involved? Please just enlighten us on this vaccination program.
Well, for the vaccination program, the federal government of Nigeria has done well, as that from 2004, they have incorporated the vaccine into the national program on immunization, and that is ongoing. Any child below 5 years can still get vaccinated, but usually within the first 1 year, the child will have been fully vaccinated. So that program is on. However, for adults or people that are beyond that 5 years, they will need to get to hospitals or some facilities where they can be able to be screened and then be vaccinated. You may have to get to hospital and ask if you can be screened, or you get to some of the professionals and ask if you can be screened and if you can be vaccinated. So a system that has the vaccine system, so you can be able to get in touch with the hospital or with the professionals and get tested.
So, Prof, I even want to ask, I mean, I practice in England, and I know that if you work in high risk places, maybe like hospital and some jobs, it's actually mandatory for you to have your vaccination or your status to be checked. I don't know how much of that we do here, because I've done some trainings in some hospitals, and I realize it's not majorly emphasized, or people do not see reasons why they should actually have the vaccination or get screened or get the levels of the immunoglobulin levels checked. What would be your advice, in this space?
Well, it's about education, about educating the people. For the hospitals, most of the hospitals in the country, especially the teaching hospitals and the specialist hospitals, when people are coming into them, part of the pre-placement medical examination is screening for hepatitis B, hepatitis C, HIV, and some of all those other things. And I think the people now need to know, because the hospital sometimes they will make provision for you to be vaccinated for hepatitis B. Many times you even be asking people, even the health workers, to go for the vaccination, and some of them will be dragging feet about it. Whereas this is life-threatening issue. So in the hospital setting, the vaccines for most of the standard hospital, when you are coming in, you will be screened and then you will be vaccinated, because a health worker is at a very serious risk. Even people who have to rescue people from accident scene and whatever, they are also at high risk. And we have so many people that are high risk, sexual, commercial sex workers, and so many of all those group of people, they are high risk individuals that really needs to be vaccinated. So usually you'll be screened and vaccinated. So in those health facilities that are standard, they are vaccinated. The children, the system is already there for them to be vaccinated.
Right. Wow. Thank you so much, Prof. So now, I've been screened. God forbid there is signs that possibly previous infection or maybe an ongoing infection. What's my fate? What's my fate in this case now?
Yes, when an individual is found to be hepatitis B positive, usually is the surface antigen testing, which we call the hepatitis B surface antigen, that is done for the screening. When an individual is found to be positive, there are some other further testing that is done to be able to follow up to know if the person will need treatment and the type of treatment that the person will need. So usually you want to go ahead after the surface antigen testing, you want to do the hepatitis B profiling to see what are the various other antigens and antibodies that can be picked. The surface antigen, the surface antibody, the E antigen, the E antibody, the core antibody. You want to check for those ones. Those are the hepatitis B profiling that you do. Then sometimes you also want to do surface antigen quantification, because it is this quantification that will tell you, oh, what is the level of the a viral replication. It can give you an idea. But the real viral replication testing is the viral load, hepatitis B viral load that can be done. Usually this is a molecular testing where you have to do from the blood, you have to analyze and quantify the DNA load of the viral hepatitis in the blood. Then the other thing you want to do is to really determine the extent of damage on the liver, because the liver is the primary point of damage by the hepatitis B virus. So you want to look at the extent of damage. You want to check the liver enzymes. The liver enzymes, you want to check the AST, ALT. You want to check them to see if the level, so that you can be able to determine whatever. Sometimes you may need to do liver biopsy to see the extent of those damage too. Then we have some non-invasive testing that can also be done apart from liver biopsy. This is a form of ultrasound scanning of the liver. We call it elastoplasty, that you want to be able to check the level of fibrous tissue that is in the liver to be able to determine the extent of the damage as well. So all these things will normally be analyzed within a short period of time to be able to know if the patient will need treatment and the extent to which treatment will be given to that individual.
Wow. Thank you so much. Now, an individual has come, we now know what the problem is. We now see that this is quite extensive, they need treatment, or maybe even basic, at a very early stage. What are the treatment options available that we can benefit from? And are they locally available for us in Nigeria?
Yes, we have the various treatment options. The basic treatment that we have is basically drugs therapy. So the drugs that is given, they are divided into two major parts. The drugs that will kill the virus. Usually those drugs that will kill the virus, we have so many of them, and they are being tested. Those of them that are interferon based, and those of them that are pure antiviral drugs that are given. The only thing is that if an individual is going to be given such treatment, the person will have to take the treatment for a very long time so that you can be able to achieve adequate viral suppression and for the person to be able to be free from the complications that may come up. So on one side of the treatment is the antiviral drugs that is given for that person to be able to significantly clear the virus. But the person cannot completely eliminate the virus from the liver, but you can actually reduce the level of the virus to virtually nil. And that is what we usually tell. You know, one of the things I say about the scientific world is that the scientific world is very sincere and very humble. If you cannot completely clear something, you say you cannot completely clear it. You know, if it is like some people, they will just say, we're already curing HIV. But the scientific world is sincere and humble enough to say, when you get this treatment, you'll be all right, you'll be fine, you will not die of the disease again, but we are not saying that the virus is completely eliminated. The same way too with hepatitis B virus. So those drugs can be able to take care of the virus such a way that the person will not likely come down with the complications. Then the second form of treatment is to see how we can do to help the liver to recover. So these are another types of drugs that are also given to individuals so that the liver cells can be able to, and the liver architecture, the structure of the liver can gradually recover, such a way that the various complications that are also expected to come in will not be able to come in, such as individual that is managed can be able to live a very healthy life. Right.
Thank you so much. Now, somebody asked a question that they've heard that, you know, some of these medications, they're quite dangerous, especially those ones that will kill the virus. That's how true is this?
No, they are not dangerous. They are drugs that are well tolerated. People take them without any complaints. I've had to manage so many patients and over so many years, and none has come with even a complaint of dizziness or stomach pain as a result of the drug. The drug is very, very safe these drugs that are used, they are very safe. Actually, when you begin to use those drugs for the patient feel, even when they are symptomatic before, they feel much relieved, virtually almost immediately when you are starting the drug. And there's hardly any complications or side effects that is significant in association with those drugs.
Thank you
They
so
are
much.
very, very comfortable drugs, yes.
Right, thank you. So now we will be rounding up very soon because we now have 30 minutes into it. Now, looking at, you know, the practical steps that you have been taking, what you have been doing, the hard work that you've been doing around, you know, the vaccinations and even, you know, screening in the country. What is going to be your advice to the government based on the experience you've had so far, you know, as to how we can scale this up, how we can increase the level of, you know, understanding? Because it looks to me like the major issue here is maybe a lot of people do not even know the significance of this hepatitis B in our society. Because in all honesty, I've seen hospitals where I've gone to do training, and when I ask them whether, you know, they have the hepatitis status check, a lot of people will just look at me like, what is he talking about? And I feel like you're at risk. You need to have B, C, you know, HIV, and some of these things. What is your advice, or what would be your advice? One, to the government, two, to, you know, the medical professionals, the leaders in our field who are sitting at the end of affair in terms of policy, protocols, procedures they can put in place. What would be your advice, Prof, to the country?
Thank you very much. Well, to the government, as far as this country is concerned, and our governments across the globe, there is need for us to establish hepatitis treatment centers across the country, the various countries, where individuals that are diagnosed can be referred for specialist management. There is need for us to establish that. Because I discovered that even the populace, they are unaware. Some people, when they get, they find out that they are hepatitis B positive, they go local. And some of these local things, they are, sorry to say, they are full of deceit. Some of them will go and add orthodox drug and put it with herbs and be given to people and say is their drug that is taken care of. Whereas if you are using the orthodox drug you are using, may be able to have helped because they are adding them together to it. But the local drugs will also be further damaging the liver because some of these drugs are not tested for their toxicity. So if you look at it, some of the people, the government will really need to set up viral hepatitis treatment centers across the countries so that we can be able to manage. Even among doctors, sometimes when an individual come out with hepatitis B, people even look at it because they have to face a lot of other things, a lot of other diseases, that some people even forget, what will I do for this patient now? So I think there is need for a hepatitis B viral treatment center across the country, or viral hepatitis treatment centers established in some of our institutions across the country where people can be referred to for effective management. Then the people, we really need to stop deceiving ourselves. There is hepatitis B. Hepatitis B is highly prevalent in our environment, highly prevalent. So people should go for screening. When you find out that you are positive, approach professionals that can be able to manage you so that we can prevent some other complications coming up later, and you can also prevent you transmitting the virus to people that are around you. I think our people need to be more informed. And I want to appreciate Monitor Your Health for bringing this program to life, because you are actually doing a lot of service, informing the people, educating the people about hepatitis B. This will go a long way to really save lives from premature death and from complications resulting from hepatitis B.
Thank you so much. So the final word to the people, you've talked to the professionals, you've talked to the government. So the people, the viewers who will be listening to this, what will be your final word? Just summarizing it for them so that they know what they're doing and how to prevent themselves from this disease.
Thank you. Hepatitis B is highly prevalent in the country and is associated with complications, premature death, and all sorts of things. Most of the time, people, before they get to the complications, they may not have significant symptoms. So the best thing is for you to go and be screened, go and be tested. If you are found to be negative, you may choose to be vaccinated, which is very good for you to be vaccinated. If you are found to be positive, approach proper professionals so that you can be properly treated. So to the public, go get tested and be appropriately treated if there is need or vaccinated. Thank you.
Thank you so much. So as we'll be rounding up now, to the viewers, just final notes. I know that Prof has said it all, and we know that hepatitis is a major thing. It's a major disease. We might be hearing about it, and we do not know how serious this is. Today you've heard it. If you get screened or you get to know that you have this disease early enough, you will save your own life. But you leave it without doing what you're supposed to do, the simple thing, just get tested. There are opportunities. I know we have a lot of NGO work that we do, that we even screen hepatitis for free. There's a company called Hepatitis Zero or something like that. They offer this for free. You do the screening for free. If you need treatment, we signpost you to where you can easily get the treatment. I would encourage you to follow us on our social media handles on this platform, on our Facebook page, Monitor Healthcare Limited on Facebook. You can follow me on Instagram as well, Dr. Femi Ogunremi. On Instagram, I push a lot of information, a lot of this program. Get tested, protect your life, protect the life of your relative, because once you get to a stage, like Prof said, the end of the disease, if that's the time you are presenting, it becomes more expensive, more difficult to also treat this condition. 2021 is here, 2020 is gone. This 2021, we'll pray and hope that, we have a better situation when it comes to our health. And to have that is for us to be proactive about it. Prof, we want to thank you so much for giving us your time. This is the second time. I know the first time we had technical issues, and we really appreciate you for offering to educate us on this portal. God bless you richly. And as we just end today, to the viewers, I hope you have the best of your weekend, and don't forget, health is wealth. COVID-19 is real and is ravaging our environment. Wear your mask, okay? Social distancing, wash your hands, do all the necessary. Protect yourself and protect your family. On this note, I want to thank you, and I want to say you have a wonderful weekend. And if you have any questions, please just drop them in the comments section. We'll be answering them one after the other. I think we've answered all the ones that is there now. So thank you so much, and stay safe. Bye-bye.
Bye.
Yeah, so just a minute. I think there are some questions. I'm going to answer some of your questions. Those people who are here with us on Zoom. So give us a minute.